So welcome everybody. I am Dr. Onna, and I'm very excited for you to be here. Today's topic is going to be why functional medicine. This talk is for you if you have heard about functional medicine and curious to know more, or you or your loved ones have some health concerns and you're looking to see an alternative to what you're used to, or that you are simply interested in ways to optimize your health. That you have some idea about functional medicine, but you want a deeper dive into the topic. So I hope to share this valuable information that is so dear to my heart, and I hope that you can get some practical tips for your health as we go over some major ideas of this new paradigm of medicine. And if at any point you have any questions, please feel free to type it in. If I can't cover it during my talk, I'd be happy to look at it in the end. Okay, so first, let me introduce myself and tell you a little bit about my own journey. I'm a family medicine specialist who's also boarded in integrative medicine. That means I'm not only a specialist in working just like what you know as a primary care doctor. I'm trained to be a specialist of medications, right, procedures, but I'm also trained to be a specialist in understanding your health through other alternative methods like nutrition, mind-body medicine, stress management, exercise, and look at bigger pictures. I always like to share my own personal journey of my health because that's what motivated me to create this practice and keep loving what I do. When I was in college, I kind of looked like that person in the picture. I used to live quite an intense lifestyle, lots of late nights, pressure to perform. I got into med school, as a high school student, so I was pretty intense, and I got sick quite a bit from ulcer, asthma, and chronic migraines, and so bad that I had to take time off from school. At that time, the doctors I saw treated my symptoms without really looking at the root causes. They were very, very kind. I mean, they really saw that I was suffering. And so they had me try all these different medicines. I was prescribed medicines that not only, however, didn't help, but just gave me horrible side effects. I still remember to this day that I would just have such terrible brain fogs. My skin and my mouth were just flaking and dry. And I was just exhausted. I couldn't even get on the phone, stay focused in a conversation. I couldn't even stare, at the computer screen for even 15 to 20 minutes. So as a student, that was so frustrating and unsatisfying. I was trying to go to learn medicine, but at the same time, I just felt like the medicine wasn't working for me. So I began to look at alternative solutions. And that's how I began my journey in learning functional medicine and integrative medicine. It's certainly a lifelong journey. At first, it was about understanding what made me got sick, figuring out the root cause. So for me, it was SIBO, small intestinal bacterial overgrowth, underactive thyroid that was very popular, it was very common in my family, and also severe food allergies. So over time, I learned about myself. I learned about my genetics. I learned about the food I take, the nutrition I need, the way my body gets rid of toxin, and also just how my stress response actually have a big role in playing in my health. And so I've really, over the last 20 years, made a big difference in my lifestyle and practice in my lifestyle. And so now I feel so much better. I not only don't take meds, I sleep well. I've not had a migraine for the last 20 years. But I also just feel like I'm living to my fullest potential. I have more energy than most people around me. And I'm always just feeling creative, productive at work, and feeling I could just spend a very productive day at work. But when I get home, I'm really able to just be still very present for my family. And I feel that if I can get here, I can certainly help my patients do it too. And the most rewarding part, it's when I go into a room now, I feel like even I meet very complicated patients. People have lots of symptoms. I feel that functional medicine is such a wonderful system that allows me to see such a clear blueprint and system that approach every single person and help everyone that I come across. So for people who are just tuning in, welcome. Again, this talk is for you if you're feeling stagnant with your health, feeling unsatisfied with information or lack of information about your condition, you want to be more proactive but don't know where to start, you're in the right talk right now, and that's what we're going to go into. So let's talk about what's the difference between functional medicine and conventional medicine. Well, there are certainly similarities and importance of conventional medicine. I would call conventional medicine a system where doctors treat symptoms and diseases using drugs, radiation, and surgery. And it's true. I feel like when I graduated medical school, I was in fact a specialist of medications. I learned a lot about pharmacology, and I learned about how the side effects, and learned about different scenarios. What do I need? What medications I need to treat it. I also know that for conventional medicines, and functional medicine, they're both practiced by licensed doctors. They're both evidence-based, and they're both uses diagnostic testings. And however, I think that conventional medicine certainly has a huge place in acute situations like heart attacks, broken bones, physical traumas that requires immediate attention to. So I made a little chart here in terms of making the comparison. So talked about it being great for acute. I think that functional medicine certainly has shown to have great benefit for chronic issues or for preventions of long-term illnesses. In conventional medicine, we definitely hyper-focus on one organ or one system and ignore everything else. I think it's common experience for you to probably say, I have a headache, or I'm bleeding in my gut, and then you're sent to a gastroenterologist. If you have, if you go to a doctor sometimes, if you have a vaginal issue, you'd be sent to a gynecologist rather than be attended to at the same place. And whereas in functional medicine, I think a big part we use the analogy of a baked tree. We see that all the leaves are all the different symptoms of different part of your body on the top. And then the tree trunk is kind of the system that integrates them all together. For example, all the nutrition and nutrients nurture everything. They nurture your skin, they nurture your eyes, they nurture different parts of your body. So it's not an individual thing. They're actually all related. So if you actually a nutrient deficient, like B12 deficient, it will affect not only your blood, you'll be anemic, but you also would have, some skin problems. You also would actually have some detoxification problems at your liver. So there's just these big picture that are related, and we see it that way. The conventional medicine, I also see it being more disease-oriented, right? So a conventional medicine doctor's goal a lot of times to identify the disease and treat it by prescribing medications. So for example, when a patient comes in and say, I'm really tired, and you ask all these questions and you identify that, okay, let's test. Your thyroid is what's acting up. Let's go ahead and just treat your thyroid and give you a medication. Whereas in functional medicine, it's more health-oriented. The goal is to promote health. So not only do we actually examine and say, okay, we found the issue, we look behind it and we say, well, what actually caused your thyroid to be misbehaving? Let's go ahead, rather than just give you a medication long-term to replace that thyroid and help you be not tired anymore. Let's actually figure out underlying what is causing the issue and treat that. So maybe, hopefully, we can actually not put you on a medicine long-term. I talked about conventional medicine being doctors who specialize in medications, and I think there's definitely a place for medications. And functional medicine, I talk about being specialized in 6 pillars of health. I'm going to talk about a little bit of that in the next slide. But what it really is specialized is the 6 pillars. I talked about the analogy of the leaves on the top, which is all the different parts of your body, right? The neurology, your skin, your liver, your kidney, your blood sugar, your hormone. Those are all different ways your body manifests. Your heart, right? The blood vessels. But the pillars actually are the trunk. Those are the 6 different systems that are so important. And I already used an example where nutrition is very important. But a big one I'm going to talk about today is actually digestion, Hormones, another one, and then also detoxification systems. Imagine if we actually don't detox well the toxin that comes into our body, what will happen? Would it just affect our liver, or would it actually affect all the other parts? How it will actually make us more sluggish, how it will actually make us not be able to absorb as well, how we're not able to function as well. And so all of these systems actually have big effects on our health. I also talk about conventional medicine being more expensive. It's more expensive in a sense that, yes, a lot of times there's insurance reimbursements, there's copays. But what happened, I would say, is that even though it's paid by insurance, the treatments are usually very costly, right? Even though it's offset by insurance, because you have to take them, a lot of them, indefinitely. How many diabetics do you see have to take diabetes medications or cholesterol medications for a long term and not having an end date? And those medicines only suppress the symptoms and often just don't address the underlying problem. So with all these medicines, thyroid, cholesterol, high blood pressure medicines, and when the disease progress, what will happen? You will end up needing surgery, or you end up needing, and if it's not controlled, if you're not doing well, not treating the root cause, you might need extra further care that is more costly than just medications. And of course, here we're talking about quality of life too, which is, I believe, priceless. So now functional medicine, I think it's very cost effective, even though some of them might be out of pocket costs because supplements and lab tests are not always covered by insurance. But time and time again, patients come back and they report that it's the best value they have received for the money they pay, because it not only focuses on prevention and health promoting treatments, but it actually restores people's health. Patients feel better, they have more energy, they can actually go out and do what they love, spend the time to be with people they want to be, make the money that they want to go back to making, and they don't need necessarily to take the supplements or the treatments anymore. And they just need to rely on healthy lifestyles, which is a very valuable. And a lot of times that information, that education also shares amongst generations. And so you're teaching not only yourself to be healthy, but actually your whole family becomes healthy. So it's a very cost-effective, high-value system. And lastly, I think this is the most important piece. Conventional medicine is very much driven by insurance coverage, meaning that how long the visit is, 15-minute visits are dictated by the insurance. Also, what kind of treatments is actually covered. So if insurance says, I don't cover this treatment, most likely the doctor's not going to cover that or write for that, and the patient's not going to choose that. So in essence, the insurance, who is not really a company of health, is a company that makes profit, is actually determining who and when are you going to get treatment. Whereas functional medicine is very much about helping patients look under the hood and see, hey, what's going on? What's the underlying issue? It's not driven by insurance coverage. As a result, and then a lot of them are based on lifestyle, which is not necessarily needed for insurance because it's a knowledge. Meditation or exercising or eating healthy doesn't necessarily need to be costly. So what is the functional medicine approach? I'll share with you the one that we use in my clinic. So first, I think the most important piece is that we take time to listen to your story. We take at least, and it's very common amongst functional medicines and doctors, to take at least an hour to 90 minutes to really hear your story, find out about your genetics, find out about your family history, your exposures, your preferences, your lifestyle, what are you eating, what are your behaviors, what are your moods, what are your triggers, right? To find out what really, and what are your symptoms, the water that you drink, the food available to you, your exposure to any toxins. And we look at your level of physical activity and quality of sleep. We also examine your spiritual and social factors. We look at your genetic makeup to look for any underlying causes, right? And so this is kind of the basis what we want to try to find out. And then here's the 6 pillars of health. we find any clinical imbalances and correct them by addressing these 6 pillars of health. So I look at these information and we collect through your story, and we do some lab tests based on what we're suspicious is going on is imbalance out of these 6 pillars of health. I talked earlier about the big ones that I would want to cover. It's hormones and neurotransmitters. Stress and inflammation is a big one. Digestion and absorption. I believe all disease start and end with the gut. So imagine if you cannot eat healthy, and if you eat healthy but you cannot absorb it well, or if you absorb it out and eat well but you cannot get rid of any excess, what will happen? That's really detrimental to your health. So very important part of our system. Immune response, methylation and detoxification, that's really important. And also energy production, how our body turns the food. It's all about how we actually turn our food into the energy we expel into our system. And if we can't get that efficiently into the motor in our system, how are we going to be able to function? And then based on what we have with the 6 pillars, we find with a lab test, then you figure out what's a treatment plan. Treatment plans are usually supplements, botanicals, detox supports, or prescription medicines as needed. Also, is very important is optimizing your lifestyle, such as diet, exercise, stress management. And once we address and rebalance these 6 pillars of health, you will improve your function of all your cells. And because your organs are made of millions and trillions of cells, you will improve your organ health. And that will improve your systems, your systemic health, including your nervous system, your digestive system. And finally, if all the systems in place are well, your whole state of health is going to be well. In the conventional medicine approach, when a person has a symptom with an organ, usually that is treated with isolation, and that often the medicine can be harmful to other organs. For example, statin medications are used for lowering cholesterol, but at the same time it actually can affect your liver. And so we do check your liver enzymes every year to just make sure that it's not affecting that part. Or heartburns, for example, are commonly treated by a proton pump inhibitor. But now research has shown that, actually being on long-term proton pump inhibitor, which is an acid inhibitor that prevents your body from making acid, it actually can cause colon infections and actually increase hip fractures. So as a result, your approach to heal one thing is actually affecting another thing. So very important to think about the differences. How are we doing, everybody? Send me a thumbs up if you're doing well or if you have any questions. Great. So again, I think the goal of functional medicine is really to determine the root cause of an illness and a disease in order to treat the cause of the symptoms. So oftentimes symptoms are like the tip of the iceberg. As you look, you'll start uncovering. And that's really what happens when people come in for a functional medicine visit. You will just look at a symptom and you say, where did that symptom come from? And we start asking you the right questions that kind of start help you connecting the dots rather than just focusing on one organ system. And it becomes very satisfying because you start actually making sense. It's like getting to know yourself much better and really well. I always call people going through functional medicine, going through the University of You, because you're really dedicating time and energy to really just peel off different layers that you didn't once know about yourself. And in the healing journey, you actually have to start learning a little bit more about yourself and how each dot connect with each other. In this analogy of the iceberg, I would tell you that, a very common illnesses that we see at functional medicine, for example, Alzheimer's disease, infertility issues, autoimmune, like arthritis, colon cancer. Turns out by the time you see symptoms, there's been a lot has been developing previously, and it's taken time. And I think functional medicine gives you a very good blueprint and system to start actually doing early checks. For example, I sometimes would help people uncover insulin resistance by simply asking, hey, do you get hangry? And if some of you who have girlfriends or yourself, or have girlfriends yourself, like lady friends, who you know that if you're waiting in line for too long in a restaurant and they get grumpy, you know that they don't have a very good insulin resistance because they can't fast for too long. Their blood sugar is just divoting, going down way too fast. Or if I look at people's skin exam, I can tell you how they're if they're having any zinc or food allergy or zinc deficiency, or so there are definitely your body's trying to tell you things when it comes up in symptoms. So basic principles, kind of a little reiteration. Basically, it's the clear idea that the body is really well equipped to heal itself with the right diet and with the right lifestyle. It's a personalized healthcare treatment to treat individuals, not diseases. It's there really to support the body's natural ability to heal rather than tracking disease directly. It also helps the body self-regulate and heal. Tapping into this natural ability will help promote natural healing and even prevention of many diseases. So typical conditions. Functional medicine has been proven to help a wide range of conditions, including heart disease, heart conditions, or metabolic conditions like diabetes, high blood pressures, and heart disease. Neurological and psychiatric conditions like depression, attention deficit disorder, and migraine headaches. Digestive disorders like irritable bowel syndrome, ulcers, chronic pancreatitis, acid reflux, diverticulosis, Crohn's disease, or any autoimmune diseases like rheumatoid, lupus, celiac, or skin disorders like psoriasis, acne, eczema, and hormonal problems like thyroid conditions, chronic fatigue, menopause, infertility issues. Quick question for the crowd here. Have any of you struggled with any of these conditions? Just type me, because I want you to feel empowered to know that you are in a place to start learning about a system. And it's my passion is actually to share with you and to educate you, and for you to educate your peers of this system and to feel hopeful. And the reason why I keep doing this is because I do see it every day. Every day in the last 5 years with my patients, I feel really excited and empowered when I feel them empowered with the system. So a big part of when you do work with a functional medicine doctor, I think what's the best thing about it is you would feel like it's a very personalized effort and plan, because the goal is to repair and restore the body's natural ability to heal by restoring the system's imbalance. In this case, by doing the lab test, by actually getting such a detailed history, you actually find out what is going on, what are the disbalances, how much of it is genetic, how much of it is from your sleep pattern, how much of it is from your hormones, which sixth pillar of health is actually being affected. And so since all of us individually are unique, care plans are the same, right? It would include lifestyle changes specific to you, stress management tools specifically to you, detoxification programs, nutritional supplements, botanical remedies. I do give prescription medicines, and I think that's common for functional medicine doctors because a lot of them are actually MDs or DOs. And I think a big part is actually including a health coach. A lot of functional medicine doctors are a health coach themselves, because the idea is they don't tell you what to do like in a conventional medicine setting. It really is about saying, here, this is what I see, this is your plan, because such a big part is your lifestyle. Which part are you ready to change? How much information do you need in order to make change? And so it's very powerful because you have to be part of the partner. An ounce of prevention is worth pound of cure. I think, before I mentioned a lot about just the disease specific, when people come with symptoms, but I can't stress enough about how, a lot of times when you are actually manifesting one, as we talked about, the tip of the iceberg is you are actually sitting on top of a lot of other dysfunctions if you are starting to have symptom of one sort. So when you actually start doing all the work, you're actually changing the metabolism, you're changing your immune response, you're changing a lot of things and start reversing it and making it more anti-aging, making it more, people start not getting sick as often. People start to be more resilient. They start having much stronger exercise routines. They don't feel fatigue as easily when they go off. They're able to. So for me, for example, I'm able to do some crazy schedule sometimes and not feel like I'm exhausted the next day, or I'm able to, go through really stressful scenarios or be around a lot of really sick people and not get sick because I feel that I have actually built up a really strong reservoir for prevention. But millions of people actually die from very preventable conditions like heart disease, cancers, chronic respiratory disease, stroke, and diabetes. Most of these are actually preventable. Type yes if you actually know anyone who's died or really suffered from any of, those preventable conditions. So around functional medicine, I think, what have the research have to say about it so far? I think because functional medicine does approach so much of the lifestyle aspect of it, we're going to talk about how lifestyle actually impacts health. There's a study that followed 23,000 participants that simply just did 4 behaviors. They stopped smoking. They exercised 3.5 hours a week. Actually, not stop. They did not smoke. They exercised 3.5 hours a week, which is not, not exorbitant amount. They eat a healthy diet and they maintain a healthy weight. Simply by doing those 4 things, 93% diabetes prevented, 81% heart attacks prevented, 81% heart attack prevented, 50% stroke prevented, and 36% cancer prevented. Another study actually showed when they followed 30,000 people across 52 countries in the world, similar things. They found that more than 90% prevention rate of all heart diseases. If you guys are looking for a great book to read, The Blue Zone, absolutely fabulous book to talk about people who actually live into the hundreds and what are some of the factors that cause that. So let's talk a little bit for the next 10 minutes. Let's talk a little bit about some of the specific health conditions, for examples, to kind of understand functional medicine. So in heart disease, you will hear a lot of times that genetics contribute to some degree, but I think that many factors are actually within our control. One doctor, Dr. Hyman, who's one of my mentors, he said that genetic loads the gun, but it's the environment that pulls the trigger. And I see that time and time again as I started working with more genetics and looking at results from 23andMe or other companies. I really see how we can actually use it as a great tool to understand what are your, like for example, Alzheimer's disease and ApoE gene. We find that it's actually people with that gene, you're more likely to have heart disease and more likely to have Alzheimer's disease. But being able to have that information changes your perspective of how you choose your diet, how you choose your lifestyle, and actually does in fact prevent and reverse Alzheimer's disease in a lot of the work that Dr. Edison has recently done. Very cool stuff. Anyways, so the typical thing that contributes to high heart disease are high blood pressure, high blood sugar, abnormal cholesterol. These are often treated with medications, but studies now are showing more and more that that treating these risk factors actually has little benefit or none at all. So the most effective tool actually has been found to still be lifestyle changes. And that really reduce the significant risk of heart disease. For meds, I know, there's certainly a place for meds. For example, the most common drug that people think about of heart disease is actually statin drugs. But it turns out it's comparison to actually a diet rich in insoluble fiber, almonds, soy, plant sterols for the lowering of cholesterol. And the study showed that similar rates of actually lowering your cholesterol. So I think that a healthy diet can certainly have very powerful effect, if not as powerful, but even more powerful as statins. So here are some functional meta tips for just in general for helping reverse heart disease or prevent heart disease. You might not have any, but I think these are just great tips that I want you to kind of start seeing as typical tips for functional medicine. First, phytonutrients, a little typo right there, phytonutrients, which is nutrients from plants. I'll send a handout as a thank you for joining us today. I'll share it with you. I'll email it to you after the talk. On a food plan based on phytonutrients. We always teach children to eat the rainbow. So this is a more sophisticated handout about how to eat the rainbow and the benefits of it. But you want at least 8 to 10 servings. How do you know what's a serving? It's actually like a tiny fist. If you put your hand in a fist, that's about a serving of colorful fruits and vegetables to maximize the disease-fighting benefits of vitamins, minerals, fiber, antioxidants, and anti-inflammatory molecules. The second one is actually balancing your blood sugar. Stabilizing the blood sugar with small amounts of protein, healthy fat, and healthy carbohydrates that are complex rather in the form of refined. What is refined? So my test I like to use is actually the Wonder Bread test. If you can remember what Wonder Bread looks like, you basically just can squeeze it with your finger into a tiny, tiny ball and make it into something way smaller than what it comes from. So if it was something like a carrot or something like a sweet potato, baked, it's a lot harder to actually squeeze into the tiny piece than it was Wonder Bread. And that actually takes longer for the body to break into blood sugar, and your body just feels much better with it. So that's kind of the test I like to use. But the key is actually really stop feeling hangry. Feeling hangry is not a healthy symptom, and that's kind of the beginning of people having imbalanced sugar. And it's very common in people I see with migraines or, emotional issues or depression. Balancing the blood sugar is so important. Actually, balancing blood sugar has so much well-documented studies that show that if you can balance your blood sugar well, then acne is greatly improved. Number 3 is get more fiber. The average American eats about 15 grams of fiber a day, so you want to work your way up to about 50 grams. That means more vegetables, more nuts, seeds, ground flaxseed is great. Chia seeds is great. Number 4, avoid processed foods. Do you know why, processed food have such long life? It's pretty much because they have all these extra chemicals for packing. And I'm going to talk about detoxification. And when you have processed foods, a big part is that your body's not just getting the goodies from the actual nutrients. It's actually then have to spend extra work to deal with getting rid of the extra stuff. So if you are struggling with tiredness, struggling with, you just feel inflamed, you feel tired all the time, you feel irritated all the time, a big part is actually eliminating that. You will feel, I would challenge you, and I would love to invite you to let me know how that made you feel. A lot of times people think about elimination, a detox diet. It's going on these special supplements, going on these special, retreats. And I think that it's really just simple avoidance of just going to a very simple diet. It's just a simple elimination diet itself is a great detox process. The last tip I would say is eliminate hydrogenated foods, such as margarine, shortening, processed oils. A big interesting thing is, a lot of people don't buy those anymore, but they're just still in a lot of baked goods and a lot of restaurants, chain restaurants. And so offer foods with healthy omega-3 fatty acids, coconut oil. And then another tip that I like to give people that's usually a big faux pas is actually buying big jugs of olive oil and actually leaving them out. And what happens, it becomes oxidized and it actually doesn't become as fresh, and your body ends up taking more energy to deal with these oxidized problems and stress. So you want to take advantage of just having smaller bottles of olive oil. You better bring it to the store to refill it, and then actually have it, make sure it's colored, keep it cool. If you're going to go out of town and you can't finish it, put it in your refrigerator. Super important. So if any of you are benefiting from any of these tips or think that you want to try just doing some of them, write yes, or you say, hey, I'm already doing it. Say just say I'm awesome, because it is true. Like, doing something as simple as that is really important. So now another topic I like to talk about is the gut. And I like to use anxiety or mood as a way to help introduce how important the gut is. So conventional medicine. So a lot of times conventional medicine approach anxiety. A lot of my patients have anxiety, and there's just a lot of stigma saying that it's actually emotional. You don't have the tools. It's a lot of stimulation based issues, or genetics. It's from balancing issues around balancing neurotransmitter in your brain using medications. I definitely think that cognitive behavioral therapy is just an amazing therapy that another really useful tool being used in conventional medicine. But I think in functional medicine, we look at anxiety very differently. There's so many causes. I already mentioned blood sugar imbalances is such a big thing. Turns out hormones, I think a lot of women out here who are listening probably might have experienced it or have family member who've experienced it or know someone who's experienced terrible mood problems or anxiety around their period or around menopause. And that's not just because there's just neurotransmitters. There's a lot at play with hormones. And but I went off topic because I was talking about gut. Anyway, so the root cause, a lot of times anxiety, turns out, is in the gut, because the gut we call the second brain. You actually make way more serotonin in the gut than the brain. A lot of time, the gut pathology, having abnormal infections, having leaky gut. What is a leaky gut? Is basically your gut not doing a good job absorbing nutrients and not doing a good job preventing foreign food particles to enter the bloodstream, because its job is actually to be a very tight, closed junction to prevent anything foreign to come into the bloodstream. As a result, your body just keeps reacting by saying, hey, how come there's all these foreign things coming in to the bloodstream through the gut? And so as a result, it'll start mounting responses. And when you mount these responses in your gut and your bloodstream, it actually creates inflammation and irritation. And a lot of those inflammation and irritation actually can get through the blood-brain barrier. A brain actually has a very nice barrier that's meant to prevent things from going through, just like how our gut is supposed to be. So we can have leaky gut. People can also have leaky brain. And when that happens, people get really anxious. Or get really depressed, or get really poor focus or foggy brain. And so when people really focus on treating their gut, they find so much relief in a lot of the symptoms I just talked about. Typical gut infections would be gut, small intestinal bacterial overgrowth or fungal overgrowth. People who get a lot of yeast infections should really look at their gut. Or parasites, or with people with autoimmune disease. Turns out there's a lot of bacteria in your gut that's correlated. If there's overgrowth of it, it is correlated with more autoimmune triggers. So a big place to look at it. So dysfunction of the gut can certainly lead to a lot of issues downstream. So when you actually don't have a working gut, its job is to absorb and digest and build immunity, the gut. And so if your gut's not working, you're most likely not getting enough nutrients. So that's why we do lab work on your blood and urine nutrients to determine if any of them are low. And a lot of them, specifically for your brain health, mental health, is the B vitamins, folic acid, zinc, copper. You need the omega-3s for your brain health. Your brain is made of mostly fat, so you absolutely need vitamin D, which is vitamin A, these oil-based vitamins, and the omega-3s to really help you, and also other B vitamins. But I would say another really important reason to work with a functional medicine doctor, or even just do lab tests, is actually realize that some people just end up taking very expensive supplements and actually getting maybe a third of the results, or even none, if their gut is not absorbing it very well. So it is about treating the underlying disorder or what's going on, so that you're not you're getting the biggest bang for your buck. Once again, the cost effective kind of theme that I'm talking about. Another topic. So I love talking about skin conditions in functional medicine, especially because it's just can reflect such deeper issues of the health when I see somebody. It's the largest, most visible organ. So kind of I'll do a little kind of sharing with you. So when I do an exam on people, I love looking at their nails. I love, like, just do a little gentle brush on their arms, or look at people's corner of their mouth. Just by looking at that, I could tell if you have grooves. You probably don't have a lot of protein absorption very well. You're probably short on biotin. But most importantly, I'm betting it's more because you are not having enough stomach acid, because most people get a lot of protein in our diet. We don't really live in the third world. And so it's not about what we eat, it's actually about how we absorb. And then the pilaris, the bumps in the back of your, now you can make it a party trick. When you go to a friend's and you actually see that, it's usually a B or zinc deficiency, or actually a food allergy. And I find it very intolerance. I find it very commonly related to dairy, actually. And for the little dryness around the lip, that's usually also related to CoQ10 or zinc deficiency. So very big clues that your body's trying to tell you whenever you're going through something. Another one that I like to talk about, it's acne. Acne is definitely related to blood sugar imbalances. There's lots of studies about it now, and also food intolerances or like a nutrient deficiency, because it's a chronic inflammation and infection. So a lot of times you want to look at the gut for it. So, well, I talked about the gut briefly, and I think functional medicine really is about balancing the gut health, hormones, and detoxification. I mean, I talked about the 6 pillars of health. So we covered a little bit about the gut. And now I want to talk a little bit under hormones. And under hormones, one of the most important concepts I want to share with you of functional medicine is actually a stress response. There's a hormone called the stress hormone, which is cortisol, and it's been shown to really, really cause problems for chronic conditions. And I would say most people who come to me with a lot of functional issues have some sort of dysfunction around cortisol. And especially if you have fatigue, if you have any female sex hormones issues, or you have any inflammation or pain issue, cortisol definitely plays a big role. And so it's so important to talk about this. I mean, there's so many studies that already show that the relationship between stress and health is just so high, and the results are so alarming. So what makes us make cortisol? Well, it's a healthy thing. It's a very important thing that we actually make cortisol. It's called the fight or flight response, the autonomic nervous system response, the fight or flight. So basically, it's built for us to deal with survival back when we were cavemen. So imagine you're in a you're out in the wild and you can feel a lion behind your back and you're in danger. It's natural for us to kick into the high cortisol response, where we say we need to get the hell out of there and, excuse my language, and run out and survive. In order to do that, we have to be able to take deep breaths. We have to be able to pump our heart really fast and get all the blood and muscles tight so we can run. And so as a result, all the bloods are sent to the heart and the lungs, and then we are just in a tightened muscle state. The rest, in terms of relaxing and digesting, in terms of brain, we don't need to be calculating very well, so the blood goes away from the brain. We get kind of foggy brain. Our eyes don't see as well because we don't really need to be shooting praise. We don't need to be feeding ourselves, so we're just trying to run. So we don't need that mechanism. We kind of turn it off. We need as much energy as possible siphoned away towards our heart and our lungs. So as a result, our blood sugar is just now bursting. We're like, we need every single ounce of blood sugar to go to our muscles and our heart. So as a result, our blood sugar is just in this up and down place. Well, it's great if we can survive that. But what happens in the modern day is we probably live in a lot of chronic stress responses. It's like the fire alarm drill never went away. It's kind of like if your boss calls and you said, I need to have a conversation with you about your performance, or if you're stuck in traffic, or if you have so much on your plate and it's just never ending, or the financial stresses, or if you actually have a schedule that's, really intense, or you have to fly multiple times a week for your job. These are not survival level stress. These are actually high chronic stress that we put on ourselves that we have not regulated. and evolved into. So what happened is then our body no longer know how to handle those. We don't absorb well, we don't digest well. A lot of people have IBS symptoms, irritable bowel, because they're dysregulated. A lot of people don't have good immunity because they're in that survival mode, right? The body is not putting energy into the right kind of cells to fight immunity, because as you're running away from the tiger, it doesn't matter if you need to heal that wound. And blood sugar, the way we're actually changing it, we become more likely to have diabetes, obesity. We can't get rid of fat. We don't burn fat because we want to burn, we're not geared to using that. Our cognitive function's terrible. We don't have good focus. We don't have good mood. And that's kind of a really big fundamental topic of stress and cortisol. And that's why I really got into it. Let me know if you have any questions, because I feel like if you even got feel a good sense of this is a very nice basis of functional medicine that you don't get to talk to your doctor a lot in a conventional medicine setting. And I'm seeing a time check. I only have a few more slides, so I feel pretty good about finishing on time for all of you. So now the next topic, so I did about stress, I said gut, and I talked about detoxification being very important too. So the body naturally detoxes. We turn toxins in our body into waste and get rid of it through our urine, our bowels, and our sweat, right? We need to be able to get rid of toxins from the food we eat, the water, the environment, our exposures, and the oxidative stress. So stress such as, being in the UV light for too long, being in radiation for too long. So where are we getting these toxins from? Imagine the byproducts from chemicals you're exposed to, or natural toxins we naturally get rid of through food and drink that we have. So for example, air, we have toxic emissions. Water, we get a lot of chlorine, fluoride in the water. There's a lot of pesticides running off, and also pharmaceuticals, right? People actually flush their medications a lot of times into the system. Pollution from the water, and so pesticides. Our home, there's a lot of xenohormones, like xenohormones are actually exogenous things that act like hormones in our environment that gets into our body. There's actually a book that was done as a research of a mom that was a journalist, super curious about her breast milk. So she basically went and sent off her breast milk to have it analyzed, and found that there were all these xenohormones and xeno products. And she proceeded to write a book. I forgot the name. I'm going to look it up. If you're interested, type it in. But it just started this journey about discovering, turns out, even if we live a very healthy lifestyle, we can still be exposed to so many things from our environment. And being able to detox is actually our number one guard to do. So xenohormones come from perfumes, hairsprays, room deodorizers, cooking with plastics. They're finding microplastics now in all bottled waters. Also, prescriptions have a lot of synthetic estrogens and progestins, can also stay in our system that we need to help get rid of. So we're just have lots of these in our environment. So what are some signs that your liver may need support? Oh, great, Kyria. Thanks for looking. Oh, yeah, that's the book, Breasts, A Natural and Unnatural History by Florence Williams. Thank you. Oh, and you're reading right now. How convenient. Okay, and some of the signs that your liver may need support. A slow digestive system, IBS symptoms, right? Constipation, inability to digest fats. If you poop or when you go to the bathroom, you see it floating and oily. Overweight, feeling slow and sluggish, irritable bowel, abdominal bloating, food and chemical intolerances. When you smell perfume, it's very difficult for you. You get hives easily, feeling moody, depressed, foggy-headed, fatigue, or frequent headaches. If I'm describing any of you, type yes. So with functional medicine, you can definitely, it's super important to actually support the system. The liver, for example, is the major organ of detoxification. So when the system becomes overloaded with toxic agents, they can accumulate and get trapped in the body. So you really want to be good to your liver. There's a lot of wonderful teas out there, herbs out there. So, milk thistle, super wonderful dandelion tea. There, you want to eliminate. You want to make sure you have an excellent elimination system. So the burden of the of the liver of the toxins are actually, can be eliminated. So make sure your elimination systems works, right? You're pooping well, you're peeing, you're sweating. So sweating is a big part if you're able to exercise and sweat. Otherwise, having infrared sauna or sauna is very, very helpful for this process. You want to also make sure you dilute, detoxification by dilution. That's a term I've heard that I love. You want to hydrate, right? You don't want to dilute what's in your system. So drink lots and lots of fluids, at least 8 to 10 glasses to start with. But if you're feeling the certain ways, you can definitely increase it. But important is to drink filtered water, not bottled water, filtered water. Supplementations, I think that's important. We actually need very specific ingredients like glutathione, zinc, CoQ10, alpha lipoic acids, amino acids, cruciferous vegetables. Cruciferous vegetables are like broccoli, cauliflower, things that have sulfur that are really helpful in the detox pathway. We need that in order to get that going. So, and then elimination of toxins. I would want you to stay tuned. I do a detox kind of process with my a group in the Facebook group once or twice a year for 14 days to 21 days of just eliminating, right? Really having clean living, clean eating, right? Have very simple meals, just avoiding all the processed foods, just lots of hydrations, making sure you sweat, and actually really eliminating eating only organic, and very little very little processed foods and inflammatory foods. And that's a very powerful way to go through one of these elimination diet. One of a good ones called Whole30 diet. It's a very easy system. There are many other different kinds. So I encourage you to try it out. For other people who have joined, I welcome you to participate or write your name, say hello, and ask any questions if there's anything that particular interests you while we're talking. Be sure to send a little note on chat. So in terms of what is a typical program for functional medicine, I'll share with you what it is that I do in my clinic. So I talked about in the earlier slides, clinical appointments and health coaches are a big part of it because you really want to feel like you have a team. It's not just you taking it all on. It's actually you learning and understanding it at a different pace specific to you. You figure it out. You want to review cases that are based on what previously have brought you there. You want specific targeted labs, right, that looks at what's going on out of those 6 pillars of health. I provide a video lab summary just because it's so dense, the information. It's nice to be able to go back to it even just a few months later. Everyone gets a very personalized supplement plan that changes over time as your body actually changes state. And prescriptions are sometimes needed or necessary, especially around infections or inflammation. Personal lifestyle plan. It's not just about what you eat. It's also about how you live it, how you exercise, how you relationships, community. Those are really important. Mindset. I think mindset is a super important way to create health. There's a wonderful study that showed a researcher assigned a team to practice basketball free throws, and after a month have them do it for 30 minutes, and after a month see how many free throws would that improve. And then he had another group that just visualized practicing free throws, and then he had a third group that didn't do anything. At the end of 1 month, the group that did practice for 30 minutes had a 24% improvement of their throw numbers. And then the group that just visualized actually had up to 23% improvement. And of course, the group that didn't do anything didn't have anything improve. But the point of it is just by setting a goal, having a visualization, understanding, and the right mindset, you can actually achieve close to as much as what people were actually practicing. So pretty powerful tool is just setting the right mindset. For my program, and I think a lot of the functional medicine programs out there usually have very good patient educational information and also online information. So again, I think functional medicine is super has super relevant to you. If you feel stagnant with your health and you know you deserve better, you want to feel more energy, vital, and have less symptoms. You want to take back control of your health. You want evidence that can guide you to some answers, or if you're looking for a partnership. So quickly, I just want to share with you a case study. I have someone who came to me this year who's 48-year-old. She's a manager. I'll call her Laura. She had a severe autoimmune arthritis attack. She's had it for a while, but it just got really bad really fast in the last few years. And then back pain, IBS, she gets constipated and then, and then get diarrhea. She's really anxious and she has really terrible sleep. She doesn't have the same energy she used to. She binge watches Netflix when she gets home. She has borderline blood sugar. Her cholesterol's creeping up. She can't go running and walking like she used to. And she used to be a tennis player and she loved it. Now she's even on 2 pain meds and 1 sleeping medicine, and the doctor's actually recommending more. So in the conventional medicine approach, she went to the rheumatologist, right? And they're offering the 3rd medication. Her illness is told that's genetic and nothing she can do. She goes to the GI specialist for the IBS. She got the colonoscopy. All labs are normal. And she told, well, for IBS, there's nothing you can do. It's nothing big bad. So you should just take an antidepressant that will actually help with the symptoms. And then for the sleep, she was put on Ambien and didn't get help. And she was continuing to get worse as the pain gets worse. And she was also started on the cholesterol medicines because her weight is gaining. Now she's overweight and she's being concerned about heart disease risk. So they asked her to put on a statin. So instead, on a functional medicine approach, we looked for the root cause. And as I said, I think gut is always a big clue. So we did a stool analysis. Labs show that from a urine test, major nutrient deficit needed, which if you don't have enough nutrients, especially around certain minerals and fat-based vitamins, it could really be hard to control your inflammations. She was put on a special autoimmune diet that is, great for the detox, gentle for the liver, because she's taking all these medications, and also very calming for the system. She has worked with a health coach, understanding the diet and the motivation. She learns all these stress management tools as a manager and change her lifestyle around. She used to drive actually 3 hours a day for her job, and now she actually works at home for 2 days a week and made huge difference and can sleep so much better. And most importantly, she actually feels like she has a strong toolbox for flares and just also how to approach her life. So the good news for her is that 3 months later, she actually went off all her medications. She went off 3 of her pain meds and her sleeping medicine. She lost 20 pounds. And most importantly, she actually feels she was the one in control of deciding how she got better. We treated the gut afterwards, but she actually was able to say, I knew exactly how I got better. And it wasn't because I took a pill that I didn't know how it worked within me. She was able to understand how the autoimmune diet all worked. And it was very empowering for her. She feels like she's a different person. She feels like she was healthier than back in her 30s. She felt like it was the best investment ever because now she's actually hanging out with her daughter, taking them out, taking the dog out running, and making memories again. Other people who use functional medicine, compares it to them feeling better than ever, or having more energy, sleeping better, having improved their body composition, and they just feel like they have the best team of doctor and health coach they've ever had. So there's the talk. I see that there's a question, so I will check in on that. I really enjoyed talking about this topic. There's going to be more. I'm learning to be able to share a lot of my lessons I've learned from all these CMEs and all these training I've ever been to. And I believe that it really is about creating the doctors of the future, which is you all and us all. So I invite you all to join my Happy Health community on Facebook. The goal is for you to support each other, be a great community, and share very helpful health tools for each other. So you can probably just go on Facebook if you want to just type Happy Health Community. You can also look up my page, Happy Health Institute. It'll be under that. If you have not already been signed up, I have a free e-series video of 14 Days to Health. So it's a very specific system that kind of happens all in 30 days. You get an email every few days that kind of motivate you to do little things that makes big changes. I kind of put that together after I've worked with patients for the last 10 years and found that those are almost the big topics that I go through all the time. Very helpful. So I will, if you're interested, I will actually, Kyria will type out the name of the website. I think it's www.onnalowmd.com/14 days to health for you to sign up. And lastly, I think if you are finding this to be useful, I see that there are some of people that have worked with me already. Welcome to contact me, schedule a free consult to see if this is the right method for you right now. But again, my goal is for you to actually, or anyone that you know might benefit from it. My goal is really to start sharing this information in a bigger community sense. So start just connecting. You feel free to share this webinar. It's going to be posted onto Facebook and also on my YouTube, I believe. Just find Onna Low MD on YouTube if they allow me to, because it's so long, or my website, onnalowmd.com. All right, so here's some questions. So I see that Randy, hi Randy, have some thoughts about what causes autism. So this is a big topic. However, I think there are a few ways to think about it. Actually, one of the conversation I had recently with a couple people who are doing a lot of autism work is that turns out I've been doing a lot of genetic learning about methylation, about polymorphisms, about different ways we actually show up and manifest ourselves. And turns out we actually able to look clearly into those functions of how our genes affect us. A lot of people who are diagnosed with autism, who also have all these genes, might actually not truly have the true diagnosis of autism. A lot of them might just have other in optimization of the other systems, especially around methylation, around how we optimally use or break down our neurotransmitters. So I think that in functional medicine, there's definitely a lot of benefit and support for anyone to be able to optimize their environment so that they can kind of peel off. Because what happens is this, for example, Alzheimer's disease. I'm doing a lot of Alzheimer's disease right now in my patient population, and I realize a lot of people don't truly have Alzheimer's disease or early cognitive decline. Turns out what they have are symptoms of mind fog from hormone disbalance, symptoms of mind fog from low hormones or from inflammation or metal toxicity. And I think the quick answer to that is that it is really helpful for anyone who have any diagnoses that are chronic and severe to really look through the 6 pillars of system and actually walk through the system and make sure you actually benefit you benefit well from each of those to make sure that you optimize all different systems. I think people who truly have autism also have methylation issues, right? So there's always going to be benefit for educating patients or people, the community, to understand the just really good healthy eating, very good healthy detoxification, good healthy detoxification of your home, right? Living a healthy, clean living, green living. Those are just generally great topics for everyone. But I think for people who have more issues genetically, they're more likely to not do well detoxing as well. Those people are going to benefit as well. So I hope that answered. Any more questions? And feel free to actually type in the questions, and if I can't cover it, I'd be happy to share that in the Facebook group. And for the Facebook group, I'm actually going to start having my health coach, Kyria, doing a question and answer 15-minute section live on Facebook, either through just on the comment line to offer any insight around her expertise, which is on health coaching, mindsets, creating mindset, and then motivation and also nutrition. So stay tuned to that, and that will be a very invaluable resource for all of you. All right, so I think that's it for today. Thank you so much. Coming up, I think in a couple weeks, I'll be doing a talk on adrenal fatigue. And then I'll be doing one on gut health. So stay tuned, and thank you so much for being part of this. And have a beautiful day, and acknowledge that you're being amazing human beings serving each other. And thank you for being here.